Good afternoon. Lee Harris, Mayor of Shelby County. I'm pleased to be here on behalf of the Joint Task Force. As everyone knows, we are in marathon mode at this point after 6 months of working on mitigating the spread of COVID-19. One of the priorities of the task force is a safe and careful return to economic activity. Some of you may recall that the last time I was here, we announced, along with Commissioner Mikhail Lowry, our Beautiful Comeback, which was a grant program to support close contact businesses. These are the businesses that over the course of the pandemic have been asked to take on extra precautions in order to protect their customers and keep our community safe. These are businesses like our barbershops and our beauty salons, our tattoo parlors, and massage parlors. And so our Beautiful Comeback is a way to support those businesses and the extra precautions that they have to take to keep us safe. This was a $2,000 grant program per business. We set aside about $1 million, which means we could award about 500 businesses $2,000 grants. So far, just by way of update, we've had over 300 businesses to be awarded a grant of $2,000. So that's about $600,000 in direct cash support for close contact businesses. But what that additionally means is that we have $400,000 left to award to these close contact businesses. And so we are encouraging those businesses to take notice of this potential grant award. We have also worked with the health department. The health department has agreed to set up a street team to begin the process of meeting with personal contact businesses around our community to do a couple things to both give those businesses guidance about how they may keep their operations safe and their customers safe, but in addition to give those businesses notice that they may be eligible for an award. So shout out, by the way, to Cynthia Nonnelly at the health department who will be helping to lead that effort and that street team. At this time, maybe we should bring up the slide with respect to our Beautiful Comeback. And so you see it there is how you might apply if you are the owner of one of these personal contact businesses. Again, we have $400,000 left to be awarded, and we would encourage owners of close contact businesses to apply. In addition to that, today, this morning, Chairman Emeritus Van Turner and I gave notice of an additional new support for small businesses. This is a program that is known in our office as the Share the Tab program, and Share the Tab gives grants to limited service restaurants. Limited service restaurants are the bars, and they have also borne a real impact during the pandemic. In fact, their industry, the restaurant and hospitality industry, has probably been impacted more than most industries during this pandemic. And so in order to support those businesses and their eventual return to safe operation and to economic activity, the Share the Tab program sets aside nearly $500,000 to be awarded to those businesses. There are approximately 45 or so of those businesses licensed as limited service restaurants, and those businesses would be eligible for grants upwards of $10,000 in order to help support their reopening expenses and to get them back into business. Let's bring up that slide too. There's an additional slide for that program. So you can see some of the details of the program here on the slide. Like with respect to the last program, we're encouraging limited service restaurants or bars, those 45 that have been really impacted during this pandemic, to go to the website COVID-19 Shelby County TN to apply. We also have with us Chairman Emeritus Turner, and so I'm not going to call him to the podium immediately, but maybe we can also hear a word from him about the importance of supporting these small contact businesses at some point during this briefing. Let me say before I hand it off to the next speaker that we have various programs and have done various actions over the course of the last 6 months, but we still, I believe, have a whole lot more to do. These last 6 months have really tested the capacity, the levers of local government. We've been called on to repair the economy, to help return kids to learning environments, and to confront COVID-19, the worst pandemic in 100 years. However, as I reflect on the last 6 months, one of the things that I am most proud of is the resolve and the willingness of this community to step up and to do what we can to get through this very challenging period. We've had teachers and school leaders that have worked really hard to get kids back in a learning environment, even though this school year is a school year like none before. We've had entrepreneurs who are really going through some very difficult and trying circumstances that are working really hard to return to business despite all the trying circumstances. And we have families that are making sacrifice after sacrifice to do what they can to slow the spread and mitigate the risk of COVID-19. I think we can do this because we have been doing this. So let's keep it going. At this time, I'd invite to the podium Ms. Jee Vahn Knight. Thanks.
Thank you, Mayor Harris. Good afternoon. I'm Jee Vahn Knight, Director of Growth for RedRover Sales and Marketing Strategy. On September 8th, in partnership with Mayor Lee Harris, Dr. Haushalter, the Mayor's Office, and the Shelby County Public Health Department, RedRover launched the first wave of ads and a multi-channel communication strategy in support of the Joint Task Force initiatives to combat COVID in our county. This month, you'll begin seeing countywide messaging promoting unity and determination in our efforts to fight COVID-19. At its core, we are encouraging our residents to focus on the co that matters most, the community in Shelby Co. Through this communication strategy, we will connect the public to relevant and timely information through an easy and memorable website, shelby.community. Our placements and creative will amplify the Joint Task Force important and vital message to continue the course by continuing to social distance, wash hands frequently, and wear a face mask. The campaign will grow and evolve to respond to important and timely messaging related to our county's defense against COVID-19, such as the importance of getting a flu shot this season and what the community needs to know about a forthcoming COVID-19 vaccine. The objectives are to provide up-to-date information about public health and local business topics, engage our communities through local organizations and influencers, echo important recommendations from the Health Department, the CDC, and other experts, and promote the work already being done by our community in our community. RedRover is honored to partner in this effort, joining the work already being done by the Public Health Department and the Joint Task Force to increase Shelby County participation in being part of the solution. Thank you.
Thank you, Jee. I want to invite Chairman Emeritus Van Turner to join us to say a few words, and then we'll give our data updates.
Thank you, Madam Director. Again, my name is Van Turner. I'm the Chairman Emeritus of the County Commission. I'm currently the Chair of the Hospitals and Health Committee, and I appreciate Director Haushalter and the Mayor and his team for allowing me a brief second to speak on the Share the Tab Fund. This supports restaurants and hospitality industry businesses in a tangible way. We want to make sure that we recognize the pain that they've gone through and the challenges that they have assumed as a result of shutting down for reasons related to the COVID-19 pandemic crisis. So in that respect, we want to do what we can to get these businesses back up and running, to get these restaurants back up and running, and to make sure that after we win, after we beat COVID-19, after we come out of this pandemic crisis, we still have restaurants to go to and businesses to support, and a business community that's still in place to service the community. The award gives $10,000 each to the restaurants and businesses that need the funding. There's a 40-plus limited service restaurants, 40-plus limited restaurants are prioritized, and this will cover rent, utilities, payroll, and the relaunching of expenses. You can apply at covid19.shelbycountytn.gov. Again, you can apply at covid19.shelbycountytn.gov. So again, I appreciate the mayor and his team. I appreciate all of the efforts of the mayor and his team. This has been a tough time, as he stated. We haven't seen this in 100 years, but to God be the glory that we have such able and capable leadership in the form of Mayor Lee Harris to guide us through this pandemic, and that of Director Alisa Haushalter. So on behalf of the commission, we thank them both for the fine job that they are doing and continue to do to navigate us through this crisis. Thank you very much.
Thank you, Chairman Turner and Mayor Harris, as well as Jee. I'm going to give a few data updates and also want to talk about some of the capacities that we've talked about throughout the pandemic, public health capacity, hospital capacity, and so on. Then I'm going to turn it over to Dr. Randolph, who's going to talk specifically about the updates in the new health directive, and then we'll open it up for questions. As Mayor Harris noted, we really are in marathon mode. We've got to continue to look at not only the data, but our capacity to respond to transmission and respond to outbreaks. So as of this morning, we have 30,594 cases. That's 108 new cases since yesterday. If we look at the average of new cases per day over the past week, we're at about 177 new cases per day. That is higher than what we were running before Labor Day, but it is still below the 185 that we identified in the tripwires. We have exceeded over 400 deaths, so unfortunately we've had 446 deaths to date. We still are running a very low mortality rate at about 1.5, so that's remained steady over time. What we really had to consider in the past several weeks is, one, what was going to be the impact of Labor Day, and also what was the impact of schools opening. As the data team has done their analysis, while we do know there are some clusters within specific schools, we actually have not seen a marked increase in pediatric cases with schools opening. Now, we'll continue to monitor that, and we do anticipate with some sports events and other out-of-school activities, we may still see clusters within schools. But that's actually very good news that we can't correlate a direct uptick in cases to schools opening. We do know that there was some impact of Labor Day on our numbers, but not to the degree that we experienced during 4th of July. If we look at our other capacities, so let's start with testing capacity, we know that we still have significant capacity within Shelby County. It continues to be underutilized, so we want to encourage people to get tested, but we feel very confident that if someone needs to get a test in Shelby County, they're able to get a test. Regardless of where they live, regardless of their insurance status. Our hospital capacity is actually holding very strong, so we don't have any concerns currently about our hospital capacity. And I will add to that, we haven't talked about this in a while, is we also don't have concerns about more capacity. We have worked with the West Tennessee Regional Forensic Center to increase their capacity, and so at the current time, if there was ever a need, we do have increased capacity. The fourth area is public health capacity, and we have actually grown our capacity significantly because of the CARES Act dollars that have been dedicated to our staff. So as everyone knows, we increased by 141 team members to have those individuals dedicated to not only contact tracing and enforcement, but also outreach and education. We are at a place that when we receive a report of a new case, we are able to contact or reach out to contact that case within 24 hours, which is actually the national standard. So we're very pleased with that. We also are able to respond to complaints that come in and to proactively do random assessments of businesses to assure compliance to the health directive. We will also be adding an additional 70 staff to continue to build our capacity. So with that noted, we are very confident that we can continue to move forward to get back to business and back to school. However, we need to do that in an incremental fashion. So I'm going to turn it over to Dr. Randolph. He'll speak to our updates in the health directive, and then we'll open it up for questions.
Thank you, Dr. Haushalter, Mayor Harris, fellow citizens of Shelby County. I'm Dr. Bruce Randolph, Health Officer for Shelby County. I'd like to bring you up to date and announce that effective today, we will be issuing a new health directive Health Directive number 12. And I'd like to just spend some time highlighting some of the revisions that we have made in this particular health directive. One of the things that we want to point out is that currently all businesses and services in Shelby County may open for business with the following exceptions: adult entertainment businesses and venues that are only open to people 18 and over and that have or offer close contact interactions and our communal activities, and festivals, fairs, parades, large-scale sporting events, and large-scale community events are not allowed unless the department has approved a site-specific plan for the event. The other areas of businesses that are open, and I've mentioned that businesses are open, I want to just address specifically some of the health measures pertaining to these businesses. So full-service restaurants, limited-service restaurants, bars, clubs, beer pubs, wine bars, tap rooms, hookah and vaporing and cigar bars, lounges. We encourage you to adhere to your statewide licensing guidelines as well as the following restrictions. In addition to the health measures that all businesses and services must adhere to that's outlined in this health directive, here are some specific things that we're expecting these establishments to adhere to. One, there should be no standing room seating at the physical bar, though tables can be placed and used in the bar area. Alcohol may only be served with food to customers who are seated at the table. Food services at a table for each customer should not exceed 2 hours. And if properly permitted, local and state law, any curbside and drive-through or delivery services may continue, but the sale of alcohol must stop at 10 p.m. All establishments still must close at 10 p.m., though the curbside and delivery services can continue. The other significant thing that we want to point out is that the hookah, vaping, and cigar bars, in order to operate, you must adhere to the safety measures. Your establishment must be well ventilated. Customers must be seated at least 6 feet apart. No more than 2 people at a booth. And anyone sitting at a booth must be of the same household. The tips and tubing used must be disposed of and the equipment cleaned after each use. And customers must wear a mask if they're not eating, drinking, or smoking. Dancing and singing was not allowed or permitted. That will apply also to the limited service restaurants and full service restaurants, and that is live music can occur, but no dancing inside, only outside, and you must be 6 feet apart, and music must be played in such a level that conversational speech can occur and people do not have to yell. Last thing I want to mention, last 2 things. One is that playgrounds are open, and it is up to the operators of a given playground to ensure that the safety measures are met and that the facilities are maintained accordingly. There's been some discussion about the multi-person biking vehicles. They are permitted to operate with the following conditions: that no consumption of beer or alcohol can occur while riding the vehicle. The vehicles cannot stop at a establishment in order for persons to go buy alcoholic beverage. Operators must adhere to the safety measures outlined in the directive, and patrons must wear the mask at all times, and there should not be yelling. These vehicles should be maintained at least 12 feet away from people who are seated outside or walking on the sidewalk. Last thing is that the outdoor and indoor sporting venues will continue to require 12 feet separation at this time until we determine that it would be safer to adjust that distance. With that, I will stop and entertain any specific questions that you may have. I would encourage everyone to go to our website, shelbytnhealth.com. This directive would be listed there, posted there on the website. I encourage everyone to have a copy, read it, understand, and set up your establishment accordingly, because the enforcement will be based on whether or not you are adhering to these safety measures that's outlined in this health directive.
Dominique Dillon, Fox 13.
Hello. My question is, there was a report that the fall surge is here. Is that a concern for our area, especially with everything opening up now, and it seems like we're doing a good job?
Currently, it's not a major concern. Of course, we're beginning to enter into fall, first day of fall. We're monitoring closely, but we feel that our capacity to respond to any upticks in our numbers are in place, and we feel that it is appropriate at this time that we move forward.
I'm just going to add a few comments if you don't mind. When our reproductive rate remained below 1, we knew that our surge had actually occurred in July, and we were very much at a plateau or a downward trend. Our reproductive rate is back above 1, and based on the current calculations, if we stay at the current reproductive rate, we would anticipate a surge sometime in February of next year. The importance of that information is that we do have the ability to get the reproductive rate back down to 1 or less. And if we get it less than 1, we can actually say that we've already had our surge. We could anticipate flu and other things in the fall, but it's really important that we stick to the very basics that we've talked about thus far. Wearing the facial covering, 6-foot social distancing, really meticulous hand washing and frequent hand washing, but also making decisions about where you go and the activities that you participate in. And then, did you have a follow-up question?
No, that's all.
Thank you.
Kendall Downing, WMC.
Good afternoon, everyone. First question is kind of a clarification. So for limited service restaurants, are they allowed to operate under the same parameters as full service restaurants, in assuming there's no capacity restriction with respect to limited service restaurants? Like they can seat, however many people at tables, assuming that the tables are spaced out. And then I have a follow-up.
Good afternoon. You're exactly right. Limited service restaurants have to adhere to all the restrictions that full service restaurants adhere to, and the focus on the interior is the ability to social distance, not limited to capacity.
Thank you. And then the other question was about the school transmission. I was interested in what you all said about the data team kind of crushing the numbers and determining that it doesn't appear that schools had a large-scale impact on transmission. Is that something that could be good news, as a lot of our schools here in town that have resumed in-person learning are doing it properly? What can we take away from that that data point? Thank you.
Yes, it's actually really great news. It does let us know that what's happening is working. And the other thing that's critical is we do anticipate that there will be cases in the school. But how quickly the health department gets notice, how quickly the schools take action and the health department takes action will actually contain those numbers to very small. And that part of the system is working well as well. There is good conversations and communication between the schools and the health department. If at any point there's a glitch, we work that out so that we can focus on the children being back in school. So it's very good news.
Brad Broders, Local 24.
Good afternoon, everyone. Question, knowing how much limited service bars were linked to an uptick in cases at the peak earlier this summer, what factors went into play beyond the reproductive rate that made you all feel comfortable to reopen them and the other changes you made in this new health directive? And I have a follow-up.
Okay. So it's a great question, and I will remind everyone that the data system in the state of Tennessee has its limitations and has had those limitations from the beginning. So from the beginning of the pandemic, it was difficult for any local community, including Shelby County, to pinpoint locations of transmission. We could very quickly highlight if it was a nursing home or a healthcare system because the data system allowed us to extrapolate that very quickly. As time went on, we actually had to look at evidence from other communities to drive some of our policy interventions. And what we know is that in many other communities, bars and any of the activities associated with bars, so it's really the activities, it's not the bar itself, it's the things that go on in the bar, are really high-risk behaviors for transmission, which is why we close limited service restaurants. Fast forward, we have actually added not only a lot of capacity to be able to respond if there is an outbreak associated with one bar, but we also have new data sets that allow us to more timely identify if there's an outbreak or transmission associated with a specific bar so that we can be laser focused. So we feel confident at the current time with the restrictions in place that there's less likelihood of transmission, and if transmission occurs, we can pick that up quickly and be able to intervene very, very quickly.
Thanks. And as a follow-up,
Sure.
just what does this say about, for the public watching this, what does this say about the hard work we've done and where we are right now to make you all feel comfortable about easing some pretty significant restrictions?
So that's a wonderful question, and I think we've stayed so focused on trying to get the numbers down that we probably haven't given enough accolades to this community. Everyone has worked exceptionally hard. We also know that many people have made sacrifices socially, emotionally, as well as financially, but that people have continued to adhere to the restrictions as they've been put forth with very limited exception. There's always exceptions, but those have been very limited. And as I have shared before, I think our joint task force and our ability to entertain different perspectives, although we may not always agree, entertaining and hearing those other perspectives has allowed us to really tailor our approach to Shelby County, and we're seeing the positive outcome of that. So really, everyone in Shelby County needs to pat themselves on the back for a job well done, but also recognize that our job is not finished. We do know that there will continue to be transmission. We know that across the United States numbers are going up, so we have to continue the course at the current time. And as Jee noted earlier, we've got to focus on the code that counts, which is community, and continue the course so that we have a healthy community for all.
Last question, Laura Testino, Commercial Appeal.
Hey, first question is just to confirm when the new health directive does take effect, and under the new directive, will limited service restaurants have to reapply for full service licenses as they have in recent weeks? And then I have a follow-up.
Okay, so no, they won't, from our perspective, have to apply for a full-service restaurant license to operate in Shelby County. However, they may choose to do that based on their relationship with the state and how their business is evolving. The health directive will be released today and will go into effect at midnight today. Yeah, midnight today. So it'll be tomorrow morning at midnight, 12:01. And your follow-up?
Great, thanks. Just curious if you could describe the clusters that we have seen associated with schools have often been associated with athletics. I'm curious if that you've seen, or if they have also been at all associated with events that are not related to schools outside of course, the classroom.
So actually, there's a combination of clusters that are occurring in a variety of different settings. So some of them are sports related, so knowing that people played on the same team and likely did not have social interaction outside of the team. But there are also those clusters that we know individuals played sports together and they engaged in social activities outside of the sports team as well, so that we can't pinpoint, did this occur as a result of them being together at dinner, or did this occur as a result of them playing sports together? We also have clusters that while people may be in school or at a university, that the likelihood that they contracted it at school is very low, that they contracted it outside of the school environment. So we'll continue to look at that. Each cluster is different. And typically when we do an investigation of a case or a cluster or an outbreak, it really takes layers of information to pinpoint where transmission occurred. I do want to highlight two things before we close out. One, we have made it very clear from our health department and the Back to Business group that at the current time we do not believe that contact sports are safe. They do increase the risk of transmission. And Dr. Randolph earlier mentioned hookah bars, cigar bars, as well as vape shops. Those are businesses that are able to operate with certain restrictions, but it's also important that we note that any use of tobacco or tobacco products increases the risk of transmission, as well as individuals who smoke may be more at risk of becoming ill. So we also want people to take caution and really consider whether or not they want to engage in those activities.
All right. Thanks, everyone. We'll see you back here on Thursday.
Thank you.